From the JAMA Network, this is JAMA Clinical Reviews, interviews and ideas about innovations in medicine, science, and clinical practice.
Hello, and welcome to this JAMA Clinical Reviews podcast. I'm your host, Dr. Kirsten Bibbins-Domingo, and I'm the editor-in-chief of JAMA and the JAMA Network. JAMA has published a new recommendation statement from the U.S. Preventive Services Task Force on screening for speech and language delay and disorders in children. JAMA also published the evidence report on which this recommendation statement is based. I'm speaking today with a member of the U.S. Preventive Services Task Force, Dr. Tumaini Rucker. Dr. Rucker is the head of the Division of General Pediatrics and professor of pediatrics at the University of Washington School of Medicine and Seattle Children's. She serves as the co-director of the University of Washington's Child Health Equity Research Fellowship, which is funded by the National Institutes of Health. She teaches primary care pediatrics at Seattle Children's Odessa Brown Children's Clinic, and her research focuses on improving preventive care services during early childhood. Welcome, Dr. Rucker.
Thank you. Thanks for having me, Dr. Bibbins-Domingo. I appreciate it.
Wonderful. Let's use first names, if you don't mind. I would love it if you would give us just the top line of this recommendation statement. What do our listeners need to know?
Yes. So thanks, Kirsten. I appreciate that. So the recommendation statement is actually an I statement. And that what that means is that there is not enough evidence for a recommendation for or against screening for speech and language delay and disorders. And so it's an I statement, which is actually a call for more research in this area.
So tell us, how big a problem is the issue of speech and language delay in children? And we're really talking here about children under 5 years of age, correct?
That's right. And so our recommendation statement is for screening for speech and language delay and disorders focused on children ages 5 and younger, and those kids who come to their primary care setting for screening who do not have a parent or a caregiver or a provider concern around speech and language delay and disorder. So we can call those asymptomatic, right? So that the parent has not come with a concern. There are no signs and symptoms of speech and language delay and disorders.
Right. That's a really important point. When the task force makes a recommendation statement for screening, they're not speaking to parents or clinicians who are seeking to investigate a concern that a parent has brought or that a clinician observes in the course of observing a child. This is really, should we be doing this across the board for children under ages of 5, that there isn't a concern that a parent or the clinician themselves has observed?
That's right. And I think that's really important, because one of the most important things that we can do and that I see in my own clinical setting is listening to parents and addressing their concerns. And that's why parents come to a primary care setting for their child during early childhood, 5 and younger, is when they have concerns, they want to be able to come to their pediatric provider and bring it to them and have those concerns addressed. So we definitely want to highlight, or I want to highlight how important it is to continue to do that, and that this topic for this recommendation statement does not affect that relationship or that ability to address parents' needs at all.
Wonderful. So let's back up a little bit and just give us a sense of how big an issue this is, the issue of speech and language delay. What are we really talking about, and how many children would you say are affected by this?
Yes. So it's an important issue. And I think when we look at the numbers, so if we just look at the numbers around speech and language delay in childhood, depending on what population you're looking at, the range is anywhere from 3 to 16% from the data that we have. What we do know is that the prevalence of speech and language delay and disorders is higher among children, particularly those who are Black and Latino and living in low-income communities. And that really relates to the levels of structural racism that we have in the society. So the task force is really concerned and focused on ensuring that those particular populations that are facing the disparity, and I can call out Black, Latino, and those children living in low-income communities, those are the ones that are feeling the brunt of the disparity. And we really, this as an I statement, as I said before, is a call for more research. And that research needs to really be inclusive and focus on speech and language delay and disorders in that community.
So tell us, what are the range of types of interventions? The task force says that there's not sufficient evidence for screening, but if a parent had concerns about speech or language delay, what would be the next steps in the process, and what types of interventions are there for children in whom a speech and language delay has been identified?
Yes. So the first step is a parent bring it to their provider, bring it to their pediatric clinician, and then that pediatric clinician can refer them for intervention. And what those interventions largely are around speech and language therapy. And that's often done by a speech and language pathologist or led by that individual with that level of training. And so it ranges from individual therapy for children, therapy in which the parent is trained how to provide that at home, classroom level, group intervention. So that's the mainstay of therapy for speech and language delay and disorders.
Great. But we, of course, have a rating from the task force that says that there is not sufficient evidence to make a recommendation for or against screening. That usually means that there's a gap somewhere. Either we don't have the best ways, we don't really know how to screen, or we don't really have the types of interventions that can change the trajectory of a problem when it's identified. Where are the gaps in this case?
So the good news is that it's not in that first part that you talked about, right? So we do know how to screen. We have screening tools, which are largely questionnaires that either are directly obtained from the child, where the provider is getting that information from the child in terms of their ability in speech and language, or it's parent reported. So those questionnaires work. There's diagnostic accuracy there, so we can find those kids who need intervention. So once we get that intervention, that's where we need the evidence, right? So once the referral is made and the intervention begins, we need evidence that when we refer a child 5 and younger to intervention for speech and language delay and disorder, and those children are screened positive from a primary care setting and asymptomatic, what are the outcomes of those interventions? How do those lead to improved health outcomes? And what's the balance of benefits and harms for those interventions? That's where we need more evidence.
Excellent. And tell me, what types of outcomes is the task force looking at when it's making these types of assessments of the evidence? What are the outcomes that are most important here?
So one level of the outcomes is the speech and language outcomes, right? So number of words, their expressive language or receptive language, and so forth. So speech and language outcomes are the first level. And then how does that then translate into what we can think of as health outcomes in terms of speech and language? So those would be things like academic achievement. And in this age group, you might look at something like early literacy skills, things like social and emotional development, behavior, household health and well-being. So parental stress is an example of that. So those are the 2 levels of outcomes, right? The first level is the actual speech and language outcomes, and then the health outcomes that can come from that. And we need research that looks at both levels of outcomes.
Wonderful. So what I'm hearing here is that while there are questions that have been developed and tested for identifying children that might have an issue and require further assessment, there is not as robust an evidence base, or there needs to be more research on the types of interventions and whether they both improve the most proximal thing. Do they actually improve speech and language? But also, is that related then to the longer term outcomes that are important for health in children?
Yes, that's absolutely right. And I think within that, we need those studies to focus on the children who are at greatest risk and facing the most inequities in speech and language delay and disorders. And so those would be children who are Black or Latino or living in low-income communities. So really, we need those studies to be focused and inclusive of those really important populations to be able to make a dent in the disparities that we see.
Wonderful. Such an important point. So give me the bottom line. When there is an I statement, I think it's really an alarm for the research community. It says, really pay attention here. And for the funders of research, pay attention here. This is an important area. We need more research to be done. In the meantime, what message would you have for clinicians who are taking care of children 5 and under, And maybe also for parents of children who are 5 and under.
Yeah, well, I think a couple things, and you highlighted that first one right off the bat, and I think that's important it bears repeating or needs repeating likely, in that an I statement, it is not a recommendation for or against the screening, right? It is a call for more research, and we talked about what that research needs to focus on, the interventions and the important populations that face disparities. And then what can clinicians and parents do? I think from a clinician perspective, it's really important to listen to parents and build that relationship with your families when they come in. Give them the opportunity to share their concerns about their child's speech and language development, so that when there is a concern, there's that relationship is there and the clinician can make the referral and the intervention when there's a concern. And then from the parent perspective, really to be able to understand that is a place, before children get to kindergarten, and this is the age group that we're talking about, many families don't have another resource for a healthcare professional for their child, or a professional even in education for their child. So being able to bring those concerns to their provider is really important. And so really to bring those concerns so that they can get the help that they need. And then just one other point I wanted to make about this recommendation statement is that we are focused on speech and language delay and disorders, which is not the same as the routine developmental screening that happens in pediatric primary care. So clinicians should continue to provide the care around general developmental guidance that they do in well child care visits. And this particular topic is focused on one aspect of that, which is speech and language delay and disorders.
Well, thank you for that clarification. That's really excellent. So again, maybe you can just restate the top line message and what the task force found. And if you could restate that again so that we make sure that everyone understands what we're talking about here.
Yeah, the top line is that the recommendation is on the topic of screening for speech and language delay and disorders, focused on children 5 and younger without symptoms, so without parental or provider concerns about having delay or disorder in speech and language. And what we found is a recommendation is an I statement, which is not a recommendation for or against screening, but rather it's a call for more research. And what we need is research that focuses on the outcomes of speech and language delay and disorder intervention, and focuses on the populations that face the most inequities in that, which are children who are Black, Latino, and low income. And then lastly, I would just add, it's really important for us to, as clinicians, to continue to address parental concerns when they come about around speech and language delay, and address those and get those kids into intervention.
Wonderful. Thank you so much. It's been such a pleasure speaking with you today. I've been speaking with Dr. Tumaini Coker, who is a member of the U.S. Preventive Services Task Force and a pediatrician at the University of Washington. We've been talking about the new recommendation statement from the U.S. Preventive Services Task Force on screening for speech and language delay and disorders in children. Thank you, Dr. Coker.
Thank you so much, Kirsten, for having me. I appreciate it.